want to talk to you about a new technique that's coming along. When you go to the emergency rooms with chest pain, the current method is they draw some blood tests. If chest pain that sounds like a heart attack, they push on your chest wall and it hurts, and they figure out right away it's arthritis and bursitis of the ribs called costochondritis. That's no big deal. But they can tell that, or if they can tell it's acid reflux, they give you some antacids to drink and your symptoms go away and you belch one time. That's no big deal. But when they think it might be the heart, it's so many times it is not the heart. So what they do is they admit you, they do these blood tests, and then they do a nuclear stress test. CT angiograms are coming. What are called, it started off at 16, I think, and then it went to maybe 32, and then it's up to 64 and 128 and even 256. And the higher the number, the better you can see the detail. Well, St. Francis Hospital now has a 128 slice CT scan for which you can do CT angiograms. The problem with doing these CT angiograms is there's a fair amount of radiation. But let me read something to you. A 16-slice coronary angiogram delivered a dose of 14 on this one scale, compared to 6 for coronary angiography. So we're not talking about a chest x-ray. 10 chest x-rays equal 1. So if you have 1 chest x-ray, you're equal to 1/10 of one of these units. If you had 10 chest x-rays, it would be 1 of these units. A coronary angiogram, where they inject the x-ray dye directly into your arteries, has 6 of these units, but the CT angiogram was 14 of these units. Now, I think it says 40 to 50% of coronary angiograms show minimal disease. So that would save you're going to the cath lab and running that danger, because they just inject this in the vein and it shows the blood vessels to the heart. What would I do if I went to the emergency room? I think I'd want to have a CT angiogram, even though that's going to cause cancer like in something like 1 in 500 people, because the dose of radiation is not low. Now I want to talk a minute about antioxidants. Here are a couple of important antioxidants. First of all, this company, Source Natural, I think they are a high-quality firm, so when you buy antioxidants, I think you'll be pretty safe. You know, there's a lot of information coming out about tainted food. There was that melamine addition to dog food, cat food, and probably some human foods. And Source Natural is a good, honorable company. And I think North Star is too, but North Star is not as good as Source Natural in my belief. However, Source Natural has come up with an antioxidant that I think is actually very strong. It's pomegranate extract, and it's mixed with coffee fruit extract. And I think this one is called Pom XL CB, and this one is called quercetin. And that plus resveratrol, which is the main antioxidant of wine and I think watermelon also, resveratrol, quercetin, and Pom XL, if you took one each of those, if you took 2 of one in the morning and 1 of those in the evening, or the other way around, and you did that 5 days a week, I think that would pretty much cover your bets for what you need in terms of strong antioxidants. Now, this was a little magazine that I got at Whole Foods. I heard some gossip today that Wild Oats is going to close. Now, Whole Foods bought Wild Oats. Whole Foods is much bigger than Wild Oats, and it just bought them out. There is a Whole Foods store in West Hartford, and there's a Wild Oats store in West Hartford. And personally, I think it's a good idea to keep them both open, but I don't know whether that makes sense from a business standpoint. I do know that there are some things I like about each one. I think the vitamins and the grains are grains and beans are much better at Wild Oats, whereas I think the vegetables and the fruit are presented in a much better fashion at Whole Foods. They're both very expensive. if you want inexpensive food, then I think you have to try Apple Tree, which is down across from BJ's in West Hartford. Some people told me also that Shaw's is much less expensive than most stores. Let me talk about some other vitamins. Coenzyme Q10. There's a new form of it called ubiquinol as opposed to ubiquinone. And that's a highly absorbable form of coenzyme Q10, ubiquinol. That's good for you if you're taking any of the statins like Lipitor, Vytorin, Crestor, Pravachol, or the generic one that's now available, which is Mevacor, which is called generically lovastatin. Also fish oil. Fish oil is actually, I believe, helpful to the memory. I recommend getting the liquid fish oil, which means it's the liquid, not the gel caps. Well, after you open it, you have to put it in the refrigerator. And whatever you take, don't take it more than 4 or 5 days a week. And I have this phrase called Wednesday and the weekend off. But fish oil or DHA. DHA is made, you can get a vegetarian half of fish oil called DHA from Neuromin's is the company, Neuromins, Neuromin's. Hawthorn is good for heart irregularity. Horse chestnut is good for the veins. L-arginine can help lower blood pressure, along with taurine and hawthorn. Magnesium tends to prevent the onset of diabetes if you're taking higher doses of it. Selenium paired with vitamin E, but the vitamin E has to have 8 components: 4 tocopherols, Tocopherols, and 4 tocotrienols. And that's a very good antioxidant, but I don't think it's any better than pomegranate.